What's up, guys, and welcome back to another episode of the Boost Your Biology podcast. Today, I'm joined in with two fellow Aussies. It's great to have two other Aussies on board, so don't have to worry about the time zone difference. But today, I'm joined in with Rohan and Nicholas, and today, what we're going to be discussing is their new fat-burning supplement that contains some very exotic ingredients. And I really want to bring them on the show to explore some of the pathways and the mechanisms behind which this product really targets. So Rohan and Nick, welcome to the show, guys.
Thanks for having us, mate.
Cheers.
Awesome. So maybe Rohan, do you want to give my listeners a bit of a background, tell us about your story?
Sure. So I guess into me personally, my background leading into Vanguard coming about. I sort of have two lives, I guess, when it comes to career. And people either know me for one or the other, but I've been in for over a decade into, I guess, corporate sales and business development into federal government. So that's one side of what I've been doing for a long time. The other side is more in relation to the health and fitness industry. So I've been competing in IFBB for about 12, 13 years. And just gone through the reins of personal training. I've owned a sports supplement store.
Pretty successful bodybuilder.
I've got a couple of titles there, and also just in coaching, and so coach a number of amateur athletes, male and female, and a couple pros as well. That's through my wife's coaching business. And off that, I guess I'd always wanted to explore. After having my own supplement store for 4 or 5 years, I saw all the different products coming in and out. And I guess I'm an avid reader and learner, and always trying to explore what all these ingredients do and how they work. And, there's a lot of great products out there. And, but at the same time, I guess there's a little bit of regurgitation when it comes to the sports supplement industry, and some stuff that, I don't know, it doesn't make a lot of sense to me. So it got to one point a couple of years ago. I was at a friend's of mine supplement store, and I saw a new product that hit the shelves, and was just reading the panel, and just from my own basic knowledge, it didn't make a whole lot of sense what was in this product, and apparently they're doing pretty well. And I just thought, I think it's time that I give this a crack. I've always been interested in the business perspective and running businesses and all that side of things, and obviously really interested in sports supplements and that side of the industry. So I approached Nick. Nick and I have been mates for a long time, and our families are close friends. I think my son and his daughter are probably going to end up getting married.
They're both 3 years old.
And so Nick and I started chatting, and that's where it all sort of came about with Vanguard Science. That started off about 2 years ago. It's been a really, really long process to get to this point. Obviously, just starting a business, working on formulas, iterating it and developing it, and just all the little issues that come into that. We started off, we're going to outsource to a manufacturer to get it done for us, but we're nervous about giving out our IP, I guess. Things that Nick was bringing to the table were just so incredible. I was nervous about handing this information out. And then, learning more and more about how the whole manufacturing process works, speaking with different owners of these businesses. It was one day Nick and I were just talking. I said, mate, let's just do it ourselves. Why not? So we ended up creating our own facility here in Canberra, which we're here right now. Nothing fancy, but it's exactly what we need for, starting off. We've got a processing facility in the back here. We've got a warehouse and an office. And and it's been a long process, but I can't imagine we'll be where we are now if we didn't have this, because Nick and I both have keys to the place. Nick gets an idea in his head, comes in here and starts working on it. We're both in and out of here, just experimenting, which I can't imagine we would have had that if we're working through somebody else's facility. So so that was about 2 years ago. This all started, and about 8 weeks ago we finally launched our first product, Lipoflux, which is pretty much what we've been working on the whole time. We're sort of working on a few other things at the same time, but which we're going to get back onto. We already sort of have, but we decided just to drop every other project at that point and focus purely on Lipoflux to get that out to the market. And finally did it, and it's been going really well. So 8 weeks running now, and we've got about 20 wholesalers and getting incredible feedback from user experience, and really happy. It's gone quicker and crazier than we expected.
Yeah, awesome. Yeah, before we get stuck into the formula, I just want to say that the reason why I was interested in getting you guys on the show was because I've been seeing a lot of Nick's work on some underground forums and things like that, and I noticed some of the ingredients that he was using in his formula. I think there was I think you guys caught my attention through like an Instagram ad at one stage, and I'm like, oh, what's this? And I was like, I checked out the formula. And started looking into the ingredients. I was like, shit, I've never heard of like 40% of these. So I was like, got to reach out to the lads, and that's why you guys are here today. So Nick, maybe do you want to give my listeners a bit of a
mate.
An understanding of who you are and your story, man?
Yeah, sure. So I guess professionally, I'm a medicinal chemist, former practicing pharmacist, qualified naturopath. My academic career started as a result of me sort of giving up football as a result of injuries, and then I started did a bachelor in nutrition. It started in 2002. During that time, touched on a little bit of herbal medicine. Got interested in that, so concomitantly did a Bachelor of Health Science in Complementary Medicine, which at that time was required for registration with the naturopathic societies and nutritional societies. During that time, I touched on a little bit of pharmacology, which really piqued my interest for that. So I applied for a Masters of Pharmacy and completed that 2008, 2009. Did my internships at a couple of different places. Actually, one of my lecturers insisted that I work for him as an intern. So I went and did half my internship at his pharmacy, then the other half at a hospital pharmacy. So I've sort of got a fair bit of clinical experience in that. And then in that time, I landed a job as a pharmacist in charge, and at a pretty busy community pharmacy that had a veterinary clinic next door. And the veterinary clinic, I become mates with the lead vet there, and he was a pretty enterprising dude, and yes, and we sort of connected in a way, and then I got to sort of exploit some of those compounding skills in a setting that most pharmacists wouldn't, where this guy would write up some weird and wonderful prescriptions with different modes of administration, and required my knowledge and his enterprising in order to develop delivery systems for cats with no gallbladder and stuff like that, and I guess that's where sort of my interest in medicinal chemistry sort of really sort of flourished, and I've since gone on and done postgraduate qualifications in that, at the moment I work at the university, the local university here. So that's my academic background. On a personal level, I'm a one-time bodybuilder, competed in 2009. I've got upper body genetics, but I don't have lower body genetics. Yeah, that's not despite the.
He can still lift the weight.
Yeah, he can lift the weight. He will attest to my efforts. But in any case, one-time bodybuilder. Sort of, as I said, got into weights as a result of football, and then sort of got into the sort of the forums back in the early 2000s. The forums were an anonymous method of information transmission, and I sort of built, not through any purpose or any means of wanting to actually build any notoriety, but I built some notoriety as Furion, and I still use that handle today. In number of online forums. And
the amount of times someone's asked me who I work with, and I say, Nick Furion, they're like, who? And I'm like, M.Pharm. They're like, oh, M.Pharm.
Yeah. Well, anyway, yeah. So that's through posting online, scouring research papers and answering questions, and the general forum discussions. I sort of had my services sought in terms of like some of my ideas that I was posting by some pretty big US supplement companies, and there's been a number. I won't say who they are for NDA reasons, but there's a number of supplements and supplement ingredients that are probably my creations that has become mainstays of supplements that you would pick up off the shelf today. And obviously that sort of passion has never really died. I sort of backed off from that a little bit as I got into sort of, had a family and stuff like that. So
when Nick and I started working together, and we were just discussing different supplements and this and that, and the amount of things that I was actually using at the time, and Nick was like, yeah, I formulated that. Like, oh, no shit.
Yeah. 2 steps ahead already.
Yeah. So I sort of stepped away from that, for family, professional reasons, and then and that's pretty much it, mate. As I said, like I'm not the type of person that's trying to build any notoriety. I prefer that people know me for the ingredients and things that I've brought to the supplement industry, and getting on board with Rohan, this has given us a specific avenue to be like right hands-on end to end. So so some of these wild and wonderful ingredients that I was compounding and trialing on myself and my friends, and posing these to $1 million companies that we're getting turned down. We can trial them out ourselves and bring them to productivity. So yeah.
There's a lot of similarities there with that aspect of discovery, like just wanting to find the next big thing, or like just hunting down novel compounds, novel ingredients. I'm very similar to you there, Nick. Like I love the aspect of discovery. It's like, oh, what can we find today that no one's ever spoken about? Yeah, it's that fascination aspect, that curiosity. It's like it's what we love.
A lot of mine has had origins in the fact that I've just it's things that I wanted, things that I wanted to experiment with, changing different formulations, design, making things, following leads on compounds that, natural compounds that have then become drugs in, changing different molecular structures, following those leads and then putting my own spin on it, saying, where was the shortcoming in terms of the natural ingredient and how can I overcome that? So it was more, as I said, just a fascination with it. So
yeah. And it's funny, for my listeners, just a quick fact for them, in terms of like the percentage of drugs that are on the market right now, like, I mean, what percentage of them actually stem from plant origins? Is it
new ones? Not so much. So because the new ones, obviously, we're getting these very unique molecular targets. But in terms of like original drugs, like I can think of a handful of diabetic drugs. Your metformin was goat's root extract was the original lead compound for that. And then you've got something like hexanatide, which is Byetta. It's a GLP analog. That was the Gila monster. It's a lizard. It's saliva. They use that, the XN peptide from that. You can think of even your, I think we've discussed the SGLT2 inhibitors, canagliflozin, dapagliflozin. They were developed from fluoretid, which is a flavonoid. It's actually a chalcone flavonoid that's found in apple skin and a few other plants.
Wow.
So they're just a handful. And I mean, the last one I explained them, that's only been the last sort of 6 years. But, the drug discovery has taken a serious slowdown in the last sort of 10 years. Like we've got drugs now that that can pretty much ameliorate any disease, any lifestyle disease. It's just these, you're looking at monoclonal antibodies and specific unique targets now. So in terms of like plant-derived drugs, there's probably not going to be many more.
Yeah. Have you, just out of curiosity, have you ever sort of accidentally discovered something yourself, like just by accident, like with your experiments or research? Like, has that ever happened to yourself?
Nothing that I can think of, mate. No. Nothing that I have objectively measured anyway. There's probably been a few incidentals where
you've done one of those to me. We won't know the ingredients.
Yes.
Just try this amount, and then I laid on the floor in the office here for about 4 hours in cold sweats.
That was
I googled the half-life of it, so I knew how long I'd be sick for, and I just laid there and wrote it out.
The half-life for that particular ingredient was neither here nor there, because you'd taken like 4 times an effective dose, so the half-life would have taken you to the effective dose.
My bad.
With linear animation. Yeah.
So what about, let's get stuck into some of the ingredients found within Lipoflux. So maybe Nick, do you want to start out maybe explaining what was your objective of the actual formula itself? Like, what was your initial goal and target?
Okay, so we looked at methods in which to basically acutely increase lipolysis in adipose tissue, in the most simplest terms. In terms of like a molecular target, when you pore over the research, there really is, other than like hormones, which you're never going to find a natural compound that elicits a response that's going to have a huge measurable acute effect. The beta-2 receptor was seen to be the most viable target. So we have plenty of beta-2 receptor agonists in terms of drugs. So I'm not comparing our product to drugs. What I'm doing is just comparing that as a molecular target.
Yeah.
And so as a result of that, we have very finite understanding of the way that a ligand can bind to the beta-2 receptor, or beta-1 receptor, beta-3 receptor, although the beta-3 is not really expressed in high levels in humans. Well, we don't really have the tissue to express it in high levels in humans. We know specific binding kinetics. We know the structural activity relationships of the receptor, and which is basically the components of the receptor that will bind to the ligand, cause the conformational change, and then induce the cascade after that. We know the type of receptor is, and we know the downward cascade as a result that ends up in the freeing up of free fatty acids. So what I did was basically screen as many compounds as I could through the structural activity relationships to come up with the most viable activity in terms of like the potential ligands, natural ligands that could bind that receptor. And we come up with a handful.
Some not commercially viable.
Yeah, many not commercially viable. And yeah, we narrowed it down to some that are found in Tenospora crispa. And basically, what was really interesting about those was these things normally would have been overlooked, because the normal catecholamine type structure, phenylethylamine type structure, which has the specific molecular features that allow it to bind into the beta-2 receptor, they're sort of hidden in there. They're there, but they're sort of hidden in there. And because the what's called the tetrahydroisoquinoline alkaloid, that's the type of alkaloids that we have in a specific extract, their molecular strape is more of an apophorphine, which is like a specific type of quinoline. And they are, so the specific pharmacophore is actually buried in the tetrahydroquinoline structure. So like it didn't appear like it would be viable. And it has all the molecular features that are required. So that's basically what we built it around. And then everything around that specific mode of action is complementary to it. So we're adding in for that specific alkaloid, we went and had a look at all the kinetic data where we look at how it's metabolized and its metabolic pathways and putative metabolic pathways as a result of it having so many hydroxyl groups. Hydroxyl groups basically make something more polar, more susceptible to conjugation enzymes at first pass, depending on their location. And then we basically screened a whole heap of molecules that were capable of inhibiting the most likely conjugation enzymes that would degrade that. So the kinetic data itself on the alkaloid suggests that it's only active for sort of 15 to 20 minutes, but the specific additional compounds that we've added in there, complex to the alkaloid itself, is should allow it to enjoy a longer half-life. And in terms of like the tangible objective feedback that we've received, that seems to be the case.
So this Tinospora, do you want to maybe give some context as to like maybe the traditional, do you have any traditional usage?
Yeah, so it seems to be a pretty popular. Like when I screened it, I come up with that. Then generally that's my method. I'll go back and see if it did have some sort of traditional use that might validate some of these potential pharmacological actions. Turns out it did. It had some anti-asthmatic activity, expectorant activity, things that you would expect from a beta-2 agonist. So it seems to have a history use in Southeast Asia. Depending on the part of the plant used, the stem itself seems to be used as expectorant, anti-asthmatic, antitussive actions. But yeah, depending on the plant, the section used, it was as a diaphoretic as well. So it does sort of check out in terms of like having a traditional use for its for the potential indications.
So then the classic beta-2 agonist from Western medicine is considered what, Ventolin, is that right?
Or salbutamol, it depends. You got short-acting beta agonists, you got long-acting beta agonists, you've got ultra long-acting beta agonists, and in terms of like the structural activity relationships of them, they all sort of vary. Something like clenbuterol, for instance, is a long-acting beta agonist, orally bioavailable. It's got a unique molecular structure that sees it more resistant to metabolic enzymes, highly lipophilic, so it'll have a very large volume of distribution with good bioavailability. So that's why you'll get, clenbuterol, it'll transverse the blood-brain barrier, no problems. It'll, accumulate in lipophilic tissue and in adipose tissue very well. And that's probably the reason why it's got such a successful off-label use. Then you've got things like salmeterol or vilantronol, indacaterol. They tend to have something that's got like, so they'll have the specific molecule that binds into the receptor, and then they've got like a long tail that will sort of anchor it, and that's what delegates its long-acting capabilities. It's different. So in terms of like what extract was sort of looking at mimicking, it's probably more on the lines of salbutamol or terbutaline in terms of the way that it binds and is eliminated. As I said, the highly susceptible hydroxyl groups in our extract would see it rapidly eliminated where they're not in terbutaline or salbutamol. Hence the reason why I've added the oregano extract in as a means to offset the glucuronidation that happens as a result of it.
Yeah, awesome. So just to summarize that, so basically it started out as the original formula was based around building it a formula that can at least target that beta-2 receptor specifically in fat tissue, fat cells. And then the first ingredient was the Tinospora, a specific alkaloid found in Tinospora. And then there's all these other synergistic ingredients to work around that to help with to prevent its degradation or metabolism, things like that. Is that correct?
Yeah, that's right. Yeah. To basically extend its extend its half-life and reduce its elimination, reduce its metabolic degradation so it maintains that specific phenylethylamine structure so that it's capable of binding and getting it in high enough blood levels that sort of correlate with the increase in cyclic adenosine monophosphate in that parallels the research studies, like in terms of like the concentrations that have been examined. And that's pretty much it, mate.
Yeah, awesome. So then some of the other ingredients, let's dive into those ones. So we got what was the next step in your mind? Like, what else were you planning out?
So there was to offset the metabolism of that alkaloid further. The glucuronidation pathway was a specific glucuronidation isoform that seemed to be the major pathway. After that, it would be catechol O-methyl transferase, which would basically add a methyl group to the hydroxyl at 6 carbon, and that would essentially create a metabolite that is not only eliminated quickly, but also can be a functional antagonist of the beta receptor. You going in, mate? Yeah. So what I did was try and screen for a viable catechol O-methyl transferase, a naturally occurring one. Not very many there isn't, and not very many that are viable. So we did find. Sorry, mate. Yeah,
with the COMT, so you're specifically looking at like COMT inhibitors, right? Like these. So you said there's not many other, because a lot of people are talking about green tea, ECGCs, and things like that having COMT inhibition. Are you saying that's sort of not potent enough, or?
Yeah, so I mean, like something like ECGC, and it in itself is polyhydroxylated. You can't really get a predictability on how much you're going to get in your blood at any one time or where it's going to distribute to. So for alkaloid, for instance, we know which tissues it's going to go to. So we needed something that was going to be strong enough to offset that and just basically prolong that half-life. I did look at ECGC, but like I was after something that was potentially a little bit more pleiotropic, and come across something else, because the enzyme itself, with the molecule we found in itself, it does have some cross reactivity with monoamine oxidase A specifically, which actually played in well for prolonging caffeine stimulation, and also another ingredient that's in there. So when we found that, we went, we're going to run with this.
ECGC been around for a long time, and part of what we're trying to do with Vanguard is to really bring some new things to light, rather than use some of these things are still really valid ingredients and do a really good job and have evidence, but are also being used in nearly everybody else's products. So we're trying to bring some new things to light.
You run something like ECGC, you run an academic search on that, and it seems to be like a panacea for everything. So like having some sort of selectivity for a specific target, we wanted to run with something that was more selective. So
okay, so let's sort of maybe let's explore another sort of pathway you're really focusing on. So we've got the beta-2 agonism, COMT inhibition. What was sort of maybe like the next thing you're considering?
So we wanted to augment the downstream activity. So in order to do that, we wanted the more terminal steps of beta-2 receptor activation as a result that results in increased lipolysis, freeing up of fatty acids. We wanted to basically the latter steps of that. If there was any molecules that we could identify that were able to sort of augment that was the next sort of step. We come across some specific seaweed extracts that contain these specific carotenoids that are sort of metabolized slightly different to normal carotenoids in the fact that they one specific xanthophyll component carotenoid in this Undaria extract that we have, it tends to be metabolized different in the fact that it's a little bit more stable. So it has something called an alenic bond at one end of its molecular structure, and as a result, the fatty acid chain, the aliphatic chain of the molecule itself, tends to survive first pass metabolism and tends to be able to accumulate in fat tissue due to this metabolic stability. And it basically will act as would any other fatty acid signaling in the terminal steps. So you'll get increased uncoupling protein 1 expression and everything else that comes with it.
Awesome. So maybe that uncoupling protein 1 expression seems to be a huge target for many fat burners. Maybe do you want to discuss some other ingredients that sort of hit that pathway or receptor to familiarize my audience with that?
Yeah. So, I mean, like in terms of other ingredients, I'm not quite sure of many others. That being a measure of, lipolytic activity or thermogenesis, it's more of a terminal measure. So pretty much anything that can stimulate thermogenesis, even something like capsaicin, we have a specific capsaicin analog in ours. Anything that can sort of activate thermogenesis will have uncoupling 1 activity. Whether that's direct or indirect, it's would depend on the specific target that's been identified for that molecule. What I can tell you for the xanthophyll extract in ours, it's a direct target. So like it will enter the cell as a complete molecule, and it will stimulate the uncoupling protein 1 directly rather than as a downstream. And that was the whole purpose of having it in there, complementary to the beta 2 agonist activity.
Sort of makes me wonder whether, like, by targeting all these pathways, whether it's going to still have like a secondary third benefit of like increasing insulin sensitivity, like body wide. Like, do you suspect that might be another potential benefit?
Yeah, potentially, mate. I mean, like a lot of these ingredients do have those as sort of indirect. That does happen as an indirect activity. In fact, one of our ingredients from the Theobroma extract, the fatty acid ethanolamide, that specifically targets. It's actually normally produced in our body, in our GI, and also in our brain. And it, for instance, is potentially the natural ligand for PPAR alpha. And in itself, PPAR alpha obviously induces specific genes and that are involved in insulin sensitivity. So, you've got drugs market, a lot of anti-diabetic drugs that they seem to fade away now in terms of the popularity and their safety data. They were targeting that specifically. So,
Awesome. Okay, so I guess maybe understand, like, it's going to be targeting various receptors, various pathways. Was there anything else you really wanted to? I know we've spoken about specific ingredients inhibiting the metabolism and helping with tissue selectivity. Did you ever consider like different product formatting? Like, did you consider like topical application for any of the ingredients at all, or?
No. So obviously we're under the very stringent guidelines of our authority that makes this. So
which extended the time for us to release our product.
Yeah, for flavoring. So it was always going to be oral, and in terms of the formula, obviously oral kinetics paramount, and so for xanthoid extract from an mahina extract, that's the specific compound. The xanthoids in there are the specific compounds that inhibit the COMT and also the monoamine oxidase A and a little bit to monoamine oxidase B. They're notoriously non-soluble. Like they just don't go into solution, even with N-butanol. Like you couldn't get them in there. So the research in terms of those is very promising because there's some very high very low IC50 for those specific enzymes, but reaching the tissue concentrations is the biggest challenge. And so we found some interesting papers that didn't necessarily look at the bioavailability, but looked at hydroxypropyl beta cyclodextrin complexation, basically making it more water soluble. And we more or less mimicked one method that was explained through one of the research papers, managed to get it into the cyclodextrin complex themselves, and it significantly increased its solubility. I mean, like that in itself is very easily tested. And then we've since found that as a result of increasing the solubility, increasing the bioavailability as a result, there's plenty of research papers that show that specific iterations of this xanthoid molecule you can basically exploit antioxidant activities, anti-diabetic activities, and it allows it to permeate, biological membranes, where something, like as a uncomplexed component wouldn't do that. So and that in itself is something that's very tangible in terms of like the central nervous system stimulatory activity from the product itself. And that's something that we're quite proud of, and that's one of our sort of landmark ingredients.
Yeah, so it sort of sounds like these some of these ingredients do have crossover effects in the brain, specifically in targeting monoamine oxidase A, COMT as well in the brain, so slowing the degradation of catecholamines. Was there any other interesting effects in the brain that you came across at all?
Well, we're sort of looking more at peripheral actions. The central nervous stimulatory aspect is something that we'll probably look at in our pre-workout. We've got some unique things lined up for that, just because that's the way that sort of category's sort of gone. We didn't really want to follow suit with standard formulas, but that seems to be, people like to get a buzz before they go into the gym these days. So, but in terms, we're looking at more peripheral activity. Like we'll never, other than the indirect increase in sympathetic outflow as a result of the non-pungent capsaicin analog that we have in there, that's pretty much the only thing that we specifically focused on for central nervous activity. So the COMT and the MAO inhibitory actions, they were more as a result of inhibiting that at the hepatic level and in plasma enzymes as well, and at the GI. So that was our main sort of focus. We didn't really set out to make something that was going to make people feel like they're dialing, It was more that focus around that, obviously the beta agonism, and then everything that sort of can augment that. Yeah.
So the ingredient you just mentioned, the capsaicin, for my listeners, so that's found within capsicum. Is that correct?
Yeah, it's found within any sort of capsicum species. So the thing with the capsaicins, which is probably the most familiar capsaicin, pergolonic acid. It's the length of the aliphatic chain, the alkyl chain on it. It determines its pungency. So what I mean by pungency is how it activates what's called the TRPV1 receptor. It's not even a receptor; it's actually an ion channel. But it's the activation of that they're expressed all through your GI, expressed all through your body. Where you overactivate that in the GI, that's when you can run into your chili diarrhea and stuff like that. So we didn't want it something that people were going to take daily that's going to cause that sort of GI disruption. So we went and had a look at the way in which the binding kinetics for the TRPV1, and we found that the length of the chain determines its pungency. So the length of the chain on the capsaicin determines its pungency, and the longer the chain, or specific lengths of chains, can offset that pungency. And we found one that was expressed in your Capsaicin extract, and it basically activates that with the same amplitude as capsaicin would, the shorter one. However, it doesn't have that pungency effect. So yeah, and that's more so we come up with that one then.
Yeah, awesome. I think I'm pretty sure cinnamaldehyde, does that also activate TRP?
Yeah. It does, yeah. It's a little bit of a smaller complex than that. Yeah.
But that probably tastes like absolute shit.
Oh,
Cinnamaldehyde.
dude. No, it's oregano extract. It's high in terpenes, and that is the
worst,
very polarizing ingredient. Someone like me with tainted taste buds, who's probably someone like yourself, who's like just swallowed all sorts of stuff and doesn't really, everything tastes delicious. Well, for me, like that's it's been very polarizing. But yeah, cinnamon aldehyde, that would probably be a welcome addition compared to what.
Actually, speaking of which, one of my lecturers at uni mentioned something called miracle berry that like flips. Have you heard about that? Changes the taste buds.
Yeah. I don't even know whether that would work, mate. That might turn it into something even worse. Yeah.
The originum extract, I've copped a little bit of that directly on my tongue before it was mixed with anything, and I could taste it for about 4 days.
Yeah, it's another ingredient that's really bad is tonkat urocominone.
Yeah.
So bitter.
Anything that's got a quasinoid structure like that, when you see nitrogens in there, you think bitterness. And then when you see benzene rings, you think like, yeah, it's pretty revolting.
So what's berberine? Is berberine?
Berberine's terrible. Berberine's so yeah, that's an alkaloid as well. Lots of nitrogen, lots of benzene rings joined together. Yeah, that is pretty nasty. Actually, we've got something in pre that will that is probably the worst tasting ingredient. And probably shouldn't be saying this that there is, but we've worked out a way that one will mask the flavor, and two will allow it to have acute effects that are normally observed sort of after 15 to 20 days of dosing. So.
Nick hasn't been short of creating challenges, that's for sure.
Yeah,
especially when it comes to flavoring this stuff. It hasn't been an overnight exercise, that's for sure.
I'm surprised how much flavor is a huge consideration in today's day and age.
Yeah.
20 years ago, and you buy yourself some Musashi Chief protein, you remember that stuff? Mm-hmm. You would just like, it would just float on the surface and you'd be like picking the chunks off.
Just suck it up. Yeah.
Yeah.
So, Nick, I'd like to pick your brain around alkaloids because, we've just spoken about berberine and some other ones. Maybe do you want to give some context? Caffeine's an alkaloid. There's other cool alkaloids out there. What is unique about alkaloids? What are some unique features about them?
Well, an alkaloid in itself is said to be something that contains nitrogen and is capable of traversing the blood-brain barrier. It should be anyway. Some of them, like, they probably won't as a result of their water solubility. They're more or less just like nitrogen-containing components in plants. Huge array of different biological activities that have been identified with them. Like the alkaloid is like the very top sort of classification. Underneath that, you've got thousands upon thousands of different iterations of them. Yeah. If you wanted to speak about any in particular, happy to rattle any off.
Yeah, I mean, we spoke about caffeine because I know caffeine's featuring in Lipoflux. Were you considering like maybe any nicotine analogs or anything like that?
Well, we do have a nicotine analog that we were looking at in our pre-workout, that's the one that made Rohan quite
stitch up.
Yeah,
he used me as the guinea pig.
Yeah,
that should be all right.
Yeah. So those in themselves, they're very, very unique, very simple. The alkaloids from the plant extract that Rohan ingested, very, very simple molecule in itself. Doesn't look like it would activate the nicotinic receptor. I think it's an A7 specific, alpha 7 specific.
Oh yeah.
But yeah, it's in terms of like the binding kinetics, it seems to be a partial agonist, but in terms of like the downstream activity, it's very comparable to nicotine. And in terms of exploiting that secondary dopaminergic activity, it's more comparable. So, and that's what we were looking to use it for.
Yeah.
Yeah.
So
it still might.
Sorry, go on.
I removed it. I removed it from our form. After, wow. It was actually twice.
Yeah.
Because anyway.
Jeez.
Yeah.
So I guess so obviously in the Lipoflux we have the Tinospora crispa with the oregano. That's a nice little synergy there. Then the Theobroma cacao extract, and you said that that's like standardized to a specific fatty acid fraction. I think you said the AEA. Is it AEA?
No, it's called oleol ethanolamide.
Yeah.
It's as I said, it's normally expressed in the human body. Seems to be the natural ligand for PPAR alpha. And it's actually in around about 1%. You can with a specific extract you can get it out from theobromine. Yeah.
And then the Anamarina is that's the
xanthoid extract. Yeah, so that's the one that we've complexed with hydroxypropyl beta cyclodextrin, and that's more or less, as I said, that's in there as the COMT inhibitor, MAO inhibitor. Specifically, it does have some very sort of indirect actions to show that it can increase insulin sensitivity and a few other sort of metabolic markers. But it's we specifically added in there for that specific action because when I ran it through the SAR software, I think I mentioned that earlier. The IC50 for MAO and for COM2 was perfectly within the range that we needed it to be. So
yeah, awesome. And then capsicum as well. So and the wakame seaweed. Yeah, cool. Yeah. I mean, it's great to have fellow Aussies, being innovative with formulas and. There's obviously some of these ingredients. It wouldn't surprise me if they hit the masses, in a couple of years, or some big giant ingredient companies want to like capture the ingredient and patent it. Like, it wouldn't surprise me. Yeah,
we're looking at doing that ourselves with a few other things that Nick's been working on, making it available to other businesses. So, there'll be a few things that we'll be releasing over the next sort of 12 months, which are pretty cool, which we'll make available.
Yeah, awesome. So I guess maybe do you want to give my listeners was there any final information you want to share about Lipoflux or anything else you had in mind, Rohan or Nick?
No, not really. Look, we're just being really welcoming of all of the great responses we've been getting. We just sort of started off. We've been talking about all our plans over the next, 3 to 5 years, what we want to do here, and some pretty exciting stuff. And we're getting some pretty cool people join Vanguard, which has been great, especially in the last 8 weeks. We're just, it's just growing so quickly. We're just excited about just working on some really cool things, bringing new things to light, and just bringing out some, different complexes and formulas that haven't really been dabbled with in the past. That's what we're excited about. So
that's our sort of mission. We do, as I said earlier, we don't want to sort of fit into any one category, and we don't want to be sort of restricted by the confines of any specific contract manufacturer or any specific ingredients. We understand that our formulas are not going to be familiar. Like, people are going to turn around the label and go, "What the hell is this?" Bringing the science to it in explaining it in the minutiae is a very, very difficult task. And as you can probably imagine. And so, that's what we're very appreciative for yourself, mate, for giving us this opportunity to rattle off some stuff and probably sound like weirdos, but we're happy to do that. So that's pretty much sort of our vision. So Yeah.
We love what you're doing, mate. I've been following you for a while before you and I even met. I know you and Nick knew each other, but I've been watching and listening to your stuff for ages. So then when you reached out, it was a real honor to get to know you over the last couple of months and now do this podcast. It's been really good. So appreciate that, mate.
Yeah, absolutely. And I think you guys did a really good job of breaking down the formula. I think Nick, you kept it as simple as possible. I think you guys still got some smart listeners on this podcast. So I think you did a really good job. And for those wanting to learn more about Lipoflux, I've got on my website, they can visit that. I've got all the studies linked there, everything, all the breakdown of the ingredients, the mechanisms.
That's that booklet there that we, I don't know if you can see that. It's 500 odd pages of everything that we've, you can't see it. Yeah, 500 odd pages of everything that's the sort of blueprint.
That's
more questions on it too. They can always hit us up. Our main channel is Instagram, Vanguard_science, or we have an inquiry on our website as well, or they can reach out to you as well, and we can, you can connect us up. So
sure, yeah, I'll have all those linked in the podcast description for those listening in. But yeah, I think that pretty much wraps up today's episode. Rohan, Nick, thanks lads for coming on.